Okay, good evening, everybody. Welcome back to our Growing Minds session. I hope you enjoyed yesterday's session. I know we got a ton of great questions coming in. Just a recap, in case this is the first time for you joining us, my name is Mena Mirhom. I am a psychiatrist based out of New York City, assistant professor of psychiatry out in Columbia University. And this is a wonderful program that we've got going on that Dr. Haney introduced yesterday, led by this wonderful team that we've got, just an incredible panel of experts. And I'm honored to be one of the folks who will be able to chat with us a little bit today. Yesterday's session, just a little bit of a recap in case you missed it, in case you were out, having a great Thursday night. I wanted us to remind us about a couple of things that we talked about last night that will also carry us over from our discussion today. The theme for today is going to be managing behavioral challenges in children. And just as a recap, this whole program, this whole series is really helpful if you are serving young people or if you have young people of your own, if you have children that you care for. This will hopefully shed some light on some behavior. So in the last session, we talked about first and foremost, right, everything we're going to talk about, especially this session, because we're going to talk about behavioral challenges. And oftentimes when a child is misbehaving, we want to, naturally, we're human, want to get angry with them because they are being disruptive, disrespectful, talking back. And we want to begin by saying, we want to begin by not blaming the child or not blaming the parents as well. When we see this, we talked about the book of John, chapter 9, where Christ was asked, who sinned, this man or his parents? Who sinned, this little 7-year-old kid who's just cursed at me, or his mom, that he is so disrespectful and mean and whatever? We don't want to begin by asking that question. We want to begin by saying, how can I understand so that I can better assist or better support this child? We also talked a little bit about our hedging our bets, right? BETS was our acronym for where does this come from? And the same is going to apply for us here in behavioral challenges, whether it comes to acting out, being impulsive, not listening, not doing well in school. There are a couple of things we want to think about. The BETS could be either the brain or the body. We said the Lord created the body perfect, flawless in his image and likeness. But because of the fall, there is now consequences where our body, our genetic code itself, is broken. And what that means is it is not behaving the way that it should. So sometimes our body, because we have an immune deficiency or a vitamin deficiency or anemia or a thyroid abnormality, it can make us behave in a way for a child and adolescent that is not like ourselves. Even if you have an infection, right? If you can ever think back to a time where if you had a fever and you might be a little delirious, you might be saying things you don't mean, that's the same way that the body can misbehave, essentially. The second, the E in the bets, was our environment, what we're exposed to, whether this, and we'll talk more about this in this session, trauma, small things or big things can impact the way that we behave and respond, especially when we're children and we don't have the language and the capacity to do this well, to be able to address this with our words. Third is our thoughts, psychologically, what we believe about the world, what we believe about God, what we believe about each other impacts the way that we behave. And lastly, we said, and most importantly, I would say, is our soul. What do we believe about the Lord himself? What has been the spiritual impact? Where's my spiritual health, if you will? So in the team of how we make sure that our children are doing well, we want to make sure that we've got a full team. There's the Olympics now. You might be watching one Olympic sport or another. If you're watching, soccer, if you don't have the person who passes to the other person, you're not going to score. I'm a basketball guy. It's a 5-person sport. You can't have one person in there and, play 1-on-5. Sometimes with this conversation with about behavioral changes in children, we try to behave like it's a 1-on-5 sport. It's just the mom, just the dad, just the parent versus the behavior. We don't want to do that. We want to commit to having a team. We also talked a little bit about why it's important for us to develop a vocabulary of scripture. The more that we have, the psalmist says, the more that we have your word I have hidden in my heart that I may not sin against you, the more we can dispute this with evidence, the same way the Lord did from Deuteronomy in the temptation. And this is a great book that I'd recommend for folks to pick up. Pretty simple. The way that it's written is here's an issue and here's scripture. Here's an issue and here's scripture. How you can combat essentially the forces that are working against. St. Paul says we don't wrestle against flesh and blood, right? We wrestle against spiritual forces of wickedness. We also mentioned real quick, this will be a last recap slide, is that the framework that we have, and we're going to talk about this for this session as well, is we have these 5 Ds of distress, the 5 things that we think about to say, could this be a sign that I should talk to a professional? Talked about duration, depth. Is this daily? Is it impacting my duty? And is it causing something dangerous? Those 5Ds are the lenses or the glasses that we see to say to ourselves, okay, I'm not going to make a diagnosis, right? But I'm going to ask a question. This is going to make me say to myself, let me perhaps talk to a psychiatrist, let me perhaps talk to a psychologist to make sure that there might be nothing else going on. Okay. So now as we dive into our conversation, the first thing I want us to bear in mind is that behavior is a sign and not a diagnosis. What do I mean by that? What I mean is it's a communication. It's a way that I am saying something to you. Imagine it's like sign language. Have you ever seen somebody use sign language? They may not be speaking with their words, they're speaking with signs, and those signs are communicating something to you. They're saying to you, hey, get the water, right? When children don't have language yet that is sophisticated enough to tell you, hey, I'm scared. Hey, I'm nervous. Hey, I'm angry. They may not use those words. They may instead use a behavior. They may throw something, yell something, not behave, not listen, not do what you want them to do. So we want to begin by thinking that behavior is a communication and not the problem in and of itself. And then we want to say, well, what is this communicating? I want to be able to essentially, right? Some of you might be listening, or if you're a parent or a servant, might be bilingual, right? Maybe you know Arabic and maybe you know English. There's some expressions in Arabic that don't exactly have a translation in English. Some behaviors need translation. We have to translate them and say, what is the targama? What is the translation of this particular issue? And some possibilities when there is disruptive, violent, unusual behavior are some of these that we're going to unpack a little bit together today. Maybe this is ADHD. Maybe this is a mood disorder like depression, bipolar disorder. Maybe this is autism. Maybe this is a learning disability. Maybe this is substance use. Okay? These are some of the things that we translate the behavior to. And again, like we talked about last night, if we have the approach that I'm curious and I'm listening and I'm going to dig a little bit deep. You know, if you watch a good show and it's a good detective who's going to take a clue here and a clue here and a clue here and see what's going on, that's what we want to do. Okay. So we had a lot of good questions, like I said, that came over from yesterday and today, and there are also questions that are coming in live. And I encourage you, actually, let me run back to the beginning slide real quick. This QR code, as you're seeing, please take a picture of it. Send us your questions. You had some great questions last night that we were able to answer live as we were going on. We want to do that today as well. There's questions that came in from yesterday to today, and we also have some questions that are coming in live that I'm going to do my best to answer with us this evening as well. So one of the questions that came in is a fan favorite for me. I would say I have a little bit of a soapbox for this. Someone said, "How dangerous is it to vape marijuana? My son is saying it's legal and nothing is wrong with it." So what's the answer? And this is a great question. It's very timely because right now, marijuana is a multi-billion-dollar industry in the United States. And as we know, not everything that is legal, as St. Paul says, all things are lawful for me, but not all things are edifying, right? Cigarettes right now are legal for folks who are over 18. Alcohol is legal. Several substances are legal, but certainly not safe. No one would say cigarettes are safe. No one would say, even now, the data is telling us about alcohol. Now, there is no safe amount of alcohol. Every amount of alcohol actually has risks. Let's talk a little bit specifically about what could be so bad about marijuana, because the marketing about marijuana has been brilliant. It's natural, it's from the earth. All my friends are vaping it, and no one can see me at school with my little vape pen. It's very innocuous looking. But the reality is, it is objectively increasing anxiety, especially in children and teens, objectively increasing the risk of depression, and most dangerously, I was just consulting with a family actually about this yesterday. Can marijuana make you psychotic? And what I mean by that is make the child or the adolescent, somebody as young as 11 or 10 or younger, lose touch with reality, meaning they can hear voices when no one is around. They can feel like somebody's following them. They can feel like they're in danger when nothing is happening. This paranoid feeling or these psychotic symptoms of literally hearing somebody speaking to them and saying to them, you should do this or you should do that. I see this in the emergency room all the time. And I was actually speaking with one of our beloved priests from New York City who was saying to me, Mena, this has been shocking to me. I've seen 7 or 8 cases in my own youth group of kids who smoked high doses, high potency marijuana and became very psychotic. So big, huge, glaring risk This is not an innocent, innocuous thing. And the reason I say that, the reason I highlight this is because we want to be able to have the conversation with the young person, most importantly, not just to say, hey, marijuana is bad, stop doing it. Hey, vaping is bad, stop doing it. But when you're seeing behavior, oftentimes the first question we want to begin with is, what is it doing for you? What is it doing for you? For many young people, it's actually self-medication. They're taking it because they're anxious, and in the moment, they feel less anxious, and they don't realize over time it's actually increasing their anxiety. Or they're taking it because they feel depressed, and they don't realize in the moment they can feel a little bit better, a little happier, a little more giggly, but overall, it actually increases their risk. So that's a really important part there about substance use, because one of the first things you want to think about with a behavioral change is, could there be a substance part? Could there be something that they're smoking or using and I don't know about it? We mentioned some of the other conversations here from last night, and we'll get into it today as well. Medical conditions are also really important. So if there's a sudden shift in their behavior, we want to first make sure as well that we're having a discussion with a pediatrician, making sure that medically everything is okay. Talked a little bit about substance use, and now we're going to get into some of the other possibilities. So, and thankfully we have a lot of questions. So this is actually going to interact with the topic itself, but and we'll introduce each topic almost with a question from you. So someone wrote in and said, my daughter's 4 years old and she's having trouble falling asleep. She bites her teeth while she's sleeping, and she's very inflexible with changes. Every small little thing, she maybe can freak out or get really, really nervous. What could this be? The person asking the question said, is it anxiety? She's so young, I don't know what to do with it. I'm talking about one possibility. I'm not saying what this is for sure. Obviously, we don't want to diagnose somebody off of a two-line question. But one thing that we don't diagnose well oftentimes in our culture, we often miss, is something called autism spectrum disorder. One of the things that are highlighted in this question, specifically the part about the inflexibility with change, the being stuck on routine, biting the teeth while sleeping. These are some things that you can see in a toddler, like having a reduced eye contact, like being delayed in speech, very lacking social smiles, repetitive movements, hand flapping, rocking, spinning objects. These are very important signs for us to be aware of that we can see very, very early in infants and toddlers. And with autism, I know oftentimes, again, because the shame that we can live among our culture and among sort of each other, sometimes we want to do this, right? We talked about like being in denial. However, with autism, the earlier we can diagnose it, the earlier we can see these signs, the more likely we are to actually change it. It's so important to have therapy that is specific for social skills, language skills, behavioral therapy early on, and that makes a big difference in how the child can develop. So some of the other signs that we can see as well, social interaction can be difficult, communication can be difficult, and restricting in terms of interests and sensory stimulation. This is actually really important as well. Part of the reason that it can make it hard to sleep is because there could be a small sensory change in the room. Could be a little flickering light in the room. That's way more than they can handle. And there could be a change in the routine. If they got used to now sleeping not in their own room, but sleeping with a parent, it is virtually impossible to change that routine just on your own. So we want to have the possibility of autism spectrum disorder just on our minds. Okay? So we're gonna, just as a heads up, we're gonna sort of power through several of these possible diagnoses. We're not gonna we could spend an entire session on any one of these, entire session on just marijuana, on just autism. But for the sake of giving you sort of a broad overview, we're gonna tackle a couple of them together. Another question is, why is my teen always so angry and tense? It just seems like they're just walking around like with closed fists and they are holding in something that's making them incredibly angry. One possibility that we want to be thinking about, we talked yesterday about anxiety in teens, okay? This, we want to talk a little bit about depression in teens. And more specifically, I want to give you this criteria, right? Sometimes, well, what's the criteria? What's the relationship between anger and sadness, right? Sadness seems like the emotion for depression, but oftentimes it'll actually show up as anger or tension when you feel really, really sad inside. What'll come out in front is frustration, irritability. So this is some of the criteria. Remember we said in the 5 Ds of distress, you want to think about how this is impacting you, and you also want to think about how long it's taking. This is at least 2 weeks of this happening on more days than not. And this is what it'll look like. Persistent sadness or irritable mood, like we said, like being explosive, being on edge. You're losing interest and pleasure in things they used to do. For example, this is a child who, used to love playing basketball and they don't anymore. This is somebody who used to love going out with their friends and now they don't anymore. A significant change in their weight. So all of a sudden now they're just, because they're staying home more and they're eating much more, they're having a hard time sleeping, sleeping too much or too little, meaning they feel so tired because they have insomnia, hypersomnia, sleeping too much, feeling like because they're so down or sad, then they actually just want to stay in bed all day. They feel a little bit slow, they're tired, they're losing energy, they feel excessive guilt. And we talked about depression, just like every other of these conditions, there's a lot of church fathers writing about the spiritual role of this, right? Or the soul that can also be despondent or discouraged. That's why it's so important. Part of our team is to make sure, are we in church? Are we partaking of the Eucharist? Are we confessing? Because guilt can be a place where maybe I'm feeling more depressed because of sin. It's an important place for us to be able to resolve. Concentration can be off, and most importantly, most dangerously, there can be thoughts of suicide. There can be thoughts of, I don't know if my life is worth living anymore. So this is really important for us to recognize. So this is a quick sidebar or a quick note that we want to have about depression in children and adolescents. Here's an important question that we've got here as well. My son is becoming more aggressive. He's a risk taker. He leaves home in the middle of the night, he invites his friends over while they're asleep. He used to be very kind and well-mannered. It's hard to see a psychiatrist or psychologist. Could this be bipolar disorder? And someone said, well, my daughter's 15. She's very calm, but she's posting very inappropriate pictures on social media, wearing inappropriate clothes, and even wearing them to church. What could this be? We're going to talk now for a moment about bipolar disorder. So one of the potential things that we could be seeing in somebody who is becoming explosive, risk-taking, sexually inappropriate, whether it's posting things, sending things to friends, or things of that nature, and not sleeping, doing things in the middle of the night, where it's dangerous, risk-taking behavior in the middle of the night consistently. It looks like the following. These are some of the symptoms there. You have a mix between depressive symptoms and something what we call manic symptoms. In jumpy, wired, increased activity, energy, agitation. You don't really need to sleep, and you are taking kinds of decisions there that are risky, that are impulsive, that the person will regret, and they'll see that this is something that they didn't want to do, but they are up in the middle of the night, for example. Now, just I've seen some children, some young adults, some young teens who will get a way to be able to get on a gambling app and gamble out of their parents' money, or will do something impulsively, shopping and buying a whole bunch of things on Amazon all at once. Those are the manic symptoms in bipolar disorder that we can see in a young person, where they become agitated, angry, irritable, explosive, and risky. And with that as well is that you can see these depressive symptoms. And the crash after, the vast majority of the time, the child will spend this in the depressive symptoms. They'll be sad, down, depressed, but every once in a while, they'll go into a place where they are actually manic and they're caused irritable behavior. And approximately 1 to 3% of adolescents experience these symptoms. Here's a really important sidebar we didn't get to yesterday, but to answer this part of the question that's asking, the refusing treatment, what can I do? Okay. We want to hold off on this as a last resort. Most of the time, when we want to engage a child in treatment, we want to be understanding, we want to be supportive, we want to be patient, we want to see what is their goal, what do they want to get to, right? Oftentimes I'll ask a young person, what are the things that they love? What gives them joy? What makes them happy? What are they, what keeps them going day to day? And those are the places that we want to use to say, based on this is how I want to approach treatment, right? However, in the event that that doesn't work, and we do our best, and we're patient, and we're kind, and we're loving, and we're supportive, we have the family, we have Abuna, and we have uncle, and we have tant. Well, there's a last resort that we can resort to. It's important for us to bear this in mind, because when we're in a dangerous situation, when a child or an adolescent is thinking about harming themselves or is actively suicidal. I remember having one of the servants was saying to me, Mina, a mom called me and said, my child just overdosed. And the servant said, call the police. Like, what do you want me to do? Like, you have to call an ambulance, right? In the event when there is a serious threat to life, we have to be able to make this drastic but life-saving step. How does this look? One option is if you're familiar with, and especially if you're not in the crisis today in this moment, it could be worth calling your local hospital, your local emergency room, and say, do you have a crisis center? Do you have a mental health center? Because what oftentimes will happen, this is the same in my hospital, is we'll send someone, a social worker, who will go to the home and evaluate the child. And someone doesn't want to come to the hospital, but they'll come to you essentially. The ambulance will come with a social worker, a trained mental health professional, who will say, all right, let's see what's going on. Is there a dangerous situation going on that we need to be able to address? And with that, they could make the call with you to say, you know what? We actually have to take this child into the hospital, even if they don't want to. And the reason this is so important is because if you are in a place where you are really sick and you can't make the decision for yourself, this is the case if you're an adult, also the case if you are a child. You need someone who's going to actually do something that you may not agree with, but it could save your life. Okay? So I want you to remember this as an option. A, call your local hospital, get to know the local resources. Call 988. I should have put that also in the presentation. 988 is a national suicide hotline, and they have resources for mental health that you can be able to know in your area. And last resort, if none of that works, 911 is also an option. Okay. Now we'll dive into another question here. Is my 19-year-old was diagnosed with ADHD and was prescribed medication, and he takes it. So when he takes it, he's focused, he does well in school. Lately, he's not taking it, he's refusing it, dropped out of college, claims it's not for him and just wants to work. How can I convince him to take medication? So this is a great question because we mentioned medication a little bit yesterday in terms of the risk and benefit of medicines. We don't want to necessarily be coercing anybody. And if they're 19, they're becoming a young adult. We want to have a conversation around risks and benefits and what does this look like. So first, big picture about what ADHD is. This is a neurodevelopmental disorder characterized by a couple different types. You can have one kind of ADHD, and this is oftentimes missed because it doesn't make a big noise, a big fuss, where somebody is inattentive, meaning they are distracted. They don't give close attention. They make careless mistakes. They have a hard time sustaining their attention. They don't respond when they're spoken to directly. They don't really follow through on instructions. They have difficulty organizing tasks, and they avoid or they're reluctant in doing that. That's one kind of ADHD. This is the inattentive type. Then there is the hyperactive or the impulsive type. This is someone who's fidgeting, getting out of their chair, is distracted, forgetting daily activities, moves in an appropriate way. They don't sit in class. They're always moving. They can't play quietly. They're on the go. They're kind of driven by a motor. They talk really fast. They blurt out. They interrupt you. Most actually because it's disruptive. The child who is quiet and to themselves and you don't really hear them, then oftentimes you miss his diagnosis. You can also have a combined version of this. So we're going to get into a little bit now of the conversation around ADHD specifically of risks and benefits and what medications are used. In ADHD, there are examples of stimulants. These are medications like Ritalin or Concerta or Adderall or Vyvanse. And these work by increasing dopamine and norepinephrine in the brain. These medications have been around for a long time. They're very well studied and they're very safe. But as we'll talk about, they do have some risks and benefits. The reason we call them stimulants is that they stimulate the body. The person will feel like the closer the now. And you have the non-stimulants, things like Strattera or Intuitive or Clonidine. These medications actually were not originally made, especially Intuitive, were not made for ADHD. They were made for other things, but now they've been used and they don't stimulate the person. These can be very effective, especially for patients or young kids who have the hyperactive version of these disorders. Okay. And these work on other neurotransmitters in the body. So what's the benefit of treatment? What's the benefit of ADHD treatment? One possible benefit, obviously, that you're more focused and you're paying attention. This helps both academically, this helps socially, this helps the person's self-esteem because now all of a sudden they're functioning, they're doing well in school, they're doing well with their peers. It helps behaviorally because now they don't feel like they're blurting out anymore. They're not disruptive, they're not interrupting, they're not getting in the way of things. Even their friends are not as annoyed with them as they used to be because now they're not, as disruptive with their friends. And long-term benefit, there is a decreased risk of developing other the psychiatric disorders like anxiety, depression, as well as addiction as well. Because long-term untreated ADHD has a risk of developing addiction disorders. How about the risks, though, of taking medication? So we have to be very aware. This is one of the situations where we have to start very low, and you have to monitor this very carefully. They can decrease the appetite of the child. They can cause sleep difficulty, making them hard to go to sleep, increase their heart rate and blood pressure. We have to always make sure that we're checking the heart rate, checking the blood pressure when someone starts a medication like this. And it could be abused. If it's an adolescent, they could be giving it to parents, parents, friends, or other people in school, and they could be abusing it, right? And there's some question around growth suppression, but that evidence is not really substantiated. Now, what's the risk? This is really important. Remember, I was telling you yesterday that there is no non non-risk option, right? There is two risk options. There is the risk of leaving this untreated or the risk of taking this medication. So the risk of leaving this untreated has an increased risk of accidents. This can be very dangerous because it's one of the leading causes of death of young people, right? Adolescents and younger is impulsivity and the inattention. If you're driving, for example, the 16, 17-year-old who begins to get their license can be prone to accidents, or even if they're not behind the wheel and they're very young, this can also give them a more likelihood to get into accidents. That's well documented. Academic challenges and failure. This for us as a culture is an easy one to remember or to bear in mind, is because we're a very driven culture. As Coptic people, we want all our kids to be very successful. So we want to set them up to be in a position to be successful. We don't want them to be fighting against themselves in this way, right? And as we said, the long-term risk, you're more likely to get in trouble with the law, more likely to have substance use disorders, more likely to have other mental health disorders if you leave this untreated. Okay, that's some of the parts there that we wanted to highlight. So some questions are coming in. So let me just double check and make sure it's not something that is related to what we're talking about at the moment. All right, actually, let me tackle these in a moment towards the end. Okay, some other behavioral possibilities are these two in particular: oppositional defiant disorder or conduct disorder, characterized by these are ways that it's going to impact the child's daily functioning. This is somebody who's going to be frequent and persistent pattern of anger or irritability or defiance. That's an oppositional defiant disorder. It's very common. Conduct disorder is a little less common, and this is the place where we get to a point of almost dangerous, illegal, violent behavior. These are two possibilities that I want us to be aware of as well. And again, the point or the reason that we're going through all these diagnoses is not to say, oh, I think my kid has this one, but rather to say, here's what the behavior is signaling, and here's the reason for us to be able to say, well, maybe I want this to be evaluated. Okay. A big one as well that came up in a question last night. The question last night, and it's worth repeating, around my child, my teenager, a 14-year-old, is cutting herself. She's self-harming, and I'm worried and I don't know what to make of that. One pattern that sometimes causes this behavior and also can cause disruptive, sexually inappropriate, promiscuous, or disinhibited behavior is borderline personality disorder. This instability in the way that they are interpersonally or the way that they understand their self-image, and they become more impulsive, they become more risk-taking, and they get to a place where they are behaving dangerously and erratically. This can also be treated. So everything that we're talking about here, we'll talk about treatment a little bit later down the line, can be treated, but we have to recognize that this is a pattern of behavior. Borderline personality disorder can be confused oftentimes with the other mood disorder that we talked about. In either event, if you're noticing this, we want to be able to just say, again, this is not just a bad kid. This is not them just being defiant or disobedient because they want to be mean, they want to be bad, but rather this is a pattern of behavior that has a specific reason. Okay. All right. Let me pause actually here for a quick question while we're at this. So my son is in middle school and has been reported by peers and teachers for bullying classmates, spreading rumors, and pressuring friends to engage in negative behavior. This is an important point. Both bullying is a topic, and I think we'll get into it in more future sessions, but if either of those things are happening, either if your child is the victim of being bullied, this can be very dangerous for their own self-esteem. It can have a tremendous impact on the way they behave. So we need to be able to work with the school to develop a plan. In this situation, when the child is the one who is bullying, we want to take a step back and say, what could be some of the things that are causing this? One possibility, like we said here, is there could be opposition defiant disorder. One possibility, there could actually be untreated ADHD, because when you have untreated ADHD, you could be erratic in class, spreading rumors, interrupting kids, engaging in negative behaviors, including substance use. So in this situation, it's possible that this child who is bullying other kids, and sometimes a kid who is so distracted in class, doesn't want to sit still, wants to be on the move, won't focus in class, and instead will bother other kids, will bully other kids, will get in the way for other children. So that's one thing to bear in mind for that. Another question is, I'm wondering about the psychological and social factors that might be causing my child to act this way, and how can I help them resist peer pressure to make more positive, independent choices? Great question there, and related to the first one as well, is the following, that's why we said in the beginning, the orthodox understanding of personhood is not just one part of, the child. It is the biological, the psychological, the social, and the spiritual. So we begin with the spiritual. What is their spiritual understanding of their brother, right? Do they have an understanding of their brother? We can give an example of, that first interaction among siblings where Cain and Abel, where God said, where is your brother? And the response was, am I my brother's keeper? It's not my problem. I don't care. So we want to be able to dig in and unpack and say, Habibi, what is it that you understand about your sister or your brother in school? I don't care about them. They're not my brother. That's just some guy. Okay. We want to unpack that to help them develop a healthier understanding of themselves and their brother. As the church fathers tell us, no one is saved alone, right? We are saved in community. We have to instill that from the age of middle school. Additionally, as we're building their mind up spiritually, we want to also now build up their mind psychologically to say, okay, how does it feel if you're in the situation where somebody is mean to you or bullying you or saying things that hurt you? How does that make you feel? We want to hear them. We want to give them the space and the ability to put themselves in the shoes of another child. We want to understand when we're talking about social factors, social media, things like that. We talked about that, and there's going to be another session in the future. Engaging to see what is their newsfeed like. I was in a session actually this morning, and we were talking about it can be very subtle, but the same way that your newsfeed as an adult on Facebook or other things like that is quietly influencing you, you want to take a look with your child. Let's scroll through together through your TikTok for your For You page, so I can understand what's being fed to you. That's a really important part there as well. All right. So we talked about some of the risks and benefits of ADHD treatment, talked about some of the behavioral signs that can be in ODD or conduct disorder. And we talked a little bit about personality disorders as well. Let me go back here and for one more question. So I've noticed that my daughter has been avoiding social interactions and feels disconnected from her siblings and friends since we moved to another state. She also refuses to connect with her childhood friends. Is this a temporary adjustment to the new environment, or should I be concerned about this behavior? Let me actually take this a little bit back to this. This is a great question. There's actually a different disorder called adjustment disorder. Because a temporary adjustment, when it comes to things classically, like moving or a change in the household, those can cause a lot of disruptions to children. I don't know how young the daughter is here, but just because something can be temporary, oftentimes adjustment disorders will get better on their own. But it is not a reason for us to say, I don't want to offer a little bit more support temporarily in this season, right? What we don't want to do is just wait for this to just evaporate. Because oftentimes, when I move to a new place, and as a child, I have to make new friends. I have to understand what does it mean about myself. I have to navigate all these different changes. I don't know how to do it alone. I don't know the language. I don't know the tools. So we want to think about tools, about therapy actually overall. Sometimes we misunderstand this and we think about therapy like going to the doctor when we're sick, right? And we even, to be honest with you, even misunderstand that part. We want to think about going in, to a doctor for a checkup, right? For prevention. It's okay for my child, even if they see somebody, a counselor, a therapist, who will say, okay, you've been having this hard time. Let's talk about the skills that you need to make new friends here. Let's talk about the skills that are, needed for us to adjust to a new environment. Because guess what? As you know very well as the parent, this is not going to be the first and last situation where they have to adjust. So you want to help them build that muscle, that tool, that skill of how do I adjust, right? So it could be a great opportunity. Not that you should be concerned, but you want to offer some more support. That's the first possibility. The second possibility is that there very well can be an underlying depression that is not being clearly seen. Sometimes there could be sort of low-level depression where a child and an adolescent could be sort of feeling this way all along, but now it really gets triggered by something like the move. So it's important for us to take this opportunity to say, could there be more besides the adjustment? Could there also be depression that is untreated? We look for these symptoms because here you're seeing you're disconnected, you're not engaging with friends, you're not doing things that you used to love doing. Of these criteria, it's a lot of the things that we look for when it comes to looking for depression in a young person. All right, great question there as well. You can also keep your questions coming. I want to make sure, show you the QR code. This is the QR code if you want to ask more questions. Thank you for those coming in. So I wanted to give you this as we're sort of coming towards the end here, about 40 minutes in. There's a sign actually on top of my hospital in New York, and it's an inscription, and it says, "Healing comes from the Most High." And this is what we believe as Orthodox Christians, is that whether this is therapy, whether it's medicine, whether it's counseling, whether it's pastoral care with a buna, with a servant, healing has one source, and that is the Most High. That's from the Lord. So we want to make sure, whether we're talking about these medications, and we talked about for depression, for example, there are medications that are very effective. And we talked about the fact that the risk of leaving this untreated can be life-threatening, and the benefit of treating this can be life-saving. We will go to our review question, which is, which one of the following, oh, I gave you the answer there. Sorry. But you can tell me if you're paying attention. Which one of the following is a common symptom of ADHD in children? Is it that you're easily distracted, you prefer to play alone, you have excellent attention to detail, or you rarely interrupt others? So the answer here, as you saw, is A, is that you are easily distracted. And just going through the others, just for the sake of completeness, if you prefer to play quietly alone, oftentimes you want to think about the possibility, could there be autism spectrum disorder going on there? Because a big thing we want to think about with autism spectrum is that it's a big umbrella, right? You can have somebody who is what we call really high functioning, or their social skills can be really developed, but their language skills could not be. There could be one area that's very strong, but several areas that are not quite as strong. Attention to detail could also be happening in autism. You can have someone sort of hyper-focused, hyper-fixated on a detail. And sometimes this can happen, and I know some of the folks that were asking questions yesterday, with ADHD medication, a person could take a dose that is, if it's high, it makes them hyper-focused, hyper-detailed, and then after that, they are having difficulty socially because they're so zeroed in on something that they're doing. So it can make it hard for them to take a step back and be social instead. So all that to say, let me just give you one last review with an important slide that we had in the beginning, is I want you to bear in mind this one, all of these criteria. Want to think about, Are they long? How long they're going? How intense it is? How frequent? What the function is, and the risk of danger. And lastly, as we close here, is here that healing ultimately comes for us from the Most High. I want to thank you for your questions. Let me just go back to, somebody also asked, sorry, there was another side question of if you wanted to connect with me personally. So unfortunately, I'm not personally taking on new patients, but you can feel free to follow me on social media or on my website, drmirhom.com. There are some good resources there for servants, some great books that I think would be really helpful, some other resources that I think could really help us. So feel free to connect with me either there or on social media at Dr. Mirhom. We have one more question that came in, which is my daughter, who is in 8th grade, is having trouble concentrating and experiencing difficulties with remembering things and making decisions. What could be causing this? So several things can be causing this. Whenever we think about, let me take a quick drink for a second. So if somebody's having trouble focusing, paying attention, remembering things, that doesn't automatically mean ADHD. Like we talked about yesterday, if you're in 8th grade, there is a possibility that you're really anxious. And as we let's go actually to the beginning a little bit of these possibilities. Maybe, we actually didn't even touch on learning disabilities. Maybe you're having difficulty because you're very anxious. And as you're anxious, just like we've all experienced, if you're worried and anxious and you can't focus, then you can't pay attention to detail. You can't concentrate. You can't remember. Well, I've had many situations where when you treat the anxiety in the young person, it goes away, and now they can focus, they can pay attention, they're doing really well. But another possibility is also if you're really sad. If you're so sad, you're so down, you're so depressed that you can't engage. You know what? Like, I don't care about school anymore. I was just speaking with a mom 2 weeks ago. So, my daughter used to be a great student, but she's in middle school and she can't pay attention, she can't focus. But more so for her, it's like she doesn't care. She can't remember. Because think about it this way. If you've been in a situation before, maybe where you haven't slept and you're really tired, if you're tired and down and fatigued, you also can't perform well. So that's another possibility. So it could be anxiety, could be depression. It could also be ADHD from what we talked about. And all in these situations, if you have a suspicion, right, and you're wondering, well, maybe I should go seek and see someone, it would be better to see someone and for them to say to you, you know what, this is actually normative. There's nothing here that you really need to do. Then to be in a situation where 5 years later saying, oh, I wish I would have spoken with someone. And now, we've already had academic problems or legal problems or things of the sort. It's really important, actually, while we're on that note, when you are looking to see someone, to be very careful about their credentials, to make sure that if you can, if you're in an area where it's very hard, it's understandable, but whenever possible, you want to make sure the person you're seeing, you can look up their background, their training, their experience, make sure that they're experienced in treating children, adolescents, make sure their philosophy about medication is similar to yours. It's really important for us as Orthodox Christians that not every feeling that you have is going to get a medicine. I've seen that sometimes where somebody was treated and they were given, you feel sad, here's a medicine. You feel angry, here's a medicine. You feel happy, here's a medicine. So we don't have that approach. That's not the best evidence-based treatment for us as Orthodox Christians, and really in mental health in general. But, just to be transparent, just like everywhere else in medicine, there are folks who are doing this well, and there are folks who are doing this not so well. Okay. So you want to be looking for someone who's going to spend the appropriate right time with you, with your child. Let me stop sharing my screen here for a moment. I didn't realize it takes us 2 screens. But anyway, we're coming towards the end. Appropriate time evaluating the child, appropriate time with you to understand what your background is, what you're seeing at home, and oftentimes even to get records from school. Those are some of the important areas that we want to focus on. And as we come to a close here, I just want to take a second to thank you. Thank you for tuning in. Thank you for tuning into our Growing Minds program here, the series. Thank you for the great questions that you've been coming in. And I really encourage you, to tune into the rest of the sessions. They're going to be incredible, wonderful, wonderful experts that are coming in. And we're so grateful to CYC for hosting this. And glory to God forever. Amen. And we pray that this is a fruitful and blessed series for you. Thank you so much.